All right, we're joined now by Dr. Jonathan Wilson from the Grand Island Foot Clinic for this week's Health Connection.
And tonight we're talking about ankle problems, and more than 1 million people visit emergency rooms every year due to these ankle injuries. Are some people more susceptible to ankle injuries then?
They can be. It really kind of depends on what demographic you're talking about. If it's the younger population or older population. Some people who have sprained their ankle or rolled their ankle in the past could be more susceptible to recurrent injuries than in the future.
Doc, what kind of ankle injuries are out there? You got sprains, strains, fractures. Sometimes a bad sprain can be worse than even a fracture, right?
Yeah, a sprain could be worse in the meaning of it sometimes can take longer to heal. Obviously, no one hopes for a fractured ankle, but there are quite a few variations to a sprain or even a fracture. So there's lots of different types of fractures or sprains or strains that can even happen with an ankle injury.
Let's get back to the basics here. What exactly causes ankle injuries?
Well, again, it depends on the activity that the patient or the person is doing. You know, obviously, we see a lot of sports injuries or traumatic, someone steps off a curb wrong. There are those types of injuries. A lot of times it can even be overuse types of injuries. Someone who is compensating for a different injury, whether it's the other foot, ankle, knee, or hip. There's lots of different things that can come into play when it comes to an ankle injury, whether it's a traumatic fall or trip or accident, or if it's even just an overuse type of injury that can happen as well.
Okay, Doc, when should someone with an ankle issue make a trip to the Grand Island Foot Clinic and see you? Is it if they have a sprain, or what do you think?
Well, it's one of those, it really depends on the severity. Now, that can be difficult to evaluate on your own. If it's one of those where after a day or two the pain's not letting up, it's only getting worse, and you're unable to walk on it without assistance, meaning crutches or a walker or something like that, it would definitely be time for an evaluation and a possible x-ray to rule out any fractures or problems that way. If it's something that you roll your ankle and then the next day it feels better and it continues to get better, okay, maybe it's not as severe, but if it's not getting better over a couple of days, it's not a bad idea to come get evaluated.
All right, great. Dr. Jonathan Wilson, Grand Island Foot Clinic, thanks so much for being with us.
Thanks for having me.
All right.
That was